Mm. All right, so we'll get started today. Thank you guys, everyone, for coming. My name is Malika Rawal, and I'm one of the new faculty members in the Division of Endocrinology, Metabolism, Diabetes. But I'm sure you recognize me. I've been around for a couple of years. Today, I wanted to talk about artificial sweeteners and metabolic health and what's going on with those. So what's the skinny? And so I have no conflicts of interest to disclose before I get started. So when thinking of what I wanted to talk about this time, I chose this topic for several reasons. Firstly, because, artificial sweeteners, non-nutritive sweeteners, as they're also called, we know that they were developed to and marketed to help reduce sugar intake. And, the audience that I'm speaking to, all of you guys are well aware of the scope of the problem regarding sugar, obesity, diabetes, metabolic syndrome, and cardiovascular outcomes related to those, and the burden it places on our healthcare system. So this is a very immensely relevant topic. But lately, there have been studies that have shown that these artificial sweeteners and non-nutritive sweeteners really are not all that they were touted to be, and they may not be as harmless as we think that they are. So I wanted to look into that and see what the evidence actually shows. Also, for a personal reason, because anyone that has seen me in person knows I always carry, a sugar-free Red Bull or something with me. I always have my caffeine with me, so trying to see what I'm actually putting into my body and what it's doing. So these artificial sweeteners are present in many things, not just food and drink, but also other household items. And so, some advertisements that we see, kick your sugar habit, try one of these artificial sweeteners. Even in the dentistry community, they're advertised. You're supposed to have 6.5 grams of xylitol every day to have hard, shiny, white teeth. So, everyone's kind of advertising to increase your intake of artificial sweeteners over sugars. And finally, and probably my most favorite thing that I found is one of the sugar alcohols is also a very palatable insecticide. So wanted to find out more about these agents and what they do with our metabolic health. Even within endocrinology, there are still conflicting viewpoints on whether these agents are harmless or beneficial. Here we see an article that says artificial sweeteners and obesity, not the solution and potentially a problem. And then in the next article, counterpoint, artificial sweeteners for obesity are better than sugar alternatives, potentially a solution. So hopefully by going through the data that's been compiled so far, we can all learn more about these agents and whether or not they're actually harmful or harmless. So today's objectives, firstly, to define what a non-nutritive sweetener is and to talk about some of the available types. Next, we're going to move on to what effect these agents have on glucose homeostasis. And then we'll explore what effect they have on body weight itself. Then we'll talk about the relationship between artificial sweeteners and cardiovascular disease. And then identify any other known long-term consequences or benefits from non-nutritive sweetener use. So, what is a nutritive sweetener? So to know what a non-nutritive sweetener is, we have to know what a nutritive sweetener is. And these can also be called caloric sweeteners or sugars. And these are basically sweeteners that provide energy in the form of carbohydrates. And they can be classified as natural sweeteners, meaning they provide sugar, but also fiber, vitamins, minerals, other nutrients. And examples of this would be fresh fruit, which contain fructose, table sugar, honey. And they can also be classified as added nutritive sweeteners. So these are things that are designed to enhance the flavor and texture of food and to prolong their shelf life. And examples of this would be sucrose, sugar alcohols, also called polyols, like sorbitol and xylitol and erythritol, and also high fructose corn syrup. We already know that high fructose corn syrup is the enemy. So, these other compounds are also nutritive sweeteners as well. So a non-nutritive sweetener, therefore, is something that has no nutritional benefit. They're not completely absorbed in your digestive system, so they don't have a lot of those side effects that some of the nutritive sweeteners, like sugar alcohols, have, which are diarrhea and stomach upset. And they have no thermal or caloric value, so they are considered no or low-calorie substitutes to sugar. The FDA has currently approved these agents as non-nutritive sweeteners. There are other agents that are sometimes called non-nutritive sweeteners, but they actually do have some caloric value. So I stuck to the ones that are on the FDA website. And we're going to delve into these in a little more detail. So here's a little timeline of the history of non-nutritive sweeteners, abbreviated as NNS. So the first non-nutritive sweetener was saccharin, and that was developed by two scientists at Johns Hopkins in 1879. We had a long pause where saccharin was the only non-nutritive sweetener for a long time until the 1960s when aspartame was developed and put into almost every kind of food and diet beverage. And then as we can see, since the 60s, we've had, more and more agents coming into market. Most recently, in 2014, they introduced advantame as another sweetener. The first sweetener we're going to talk about is saccharin, which is the oldest. It can also be called sweet and low or sweet twin, nectar-sweet, sugar twin, and it is 300 times more sweet than sucrose or table sugar. It has a variety of uses, so not only as a tabletop sweetener, but it's in soft drinks, in baked goods, jams, salad dressings, dessert toppings, chewing gum, even toothpaste, mouthwash, lip gloss. So it is very prevalent in things that we use on a regular basis. And so these are some examples, and certainly not all inclusive, of items and agents that have saccharin in them. To determine how much of these agents is safe, the FDA has come up with an ADI, which is the acceptable daily intake for each of these agents in comparison with sugar, to tell us how much is safe for us. And so the ADI of saccharin is 15 milligrams per kilogram, which is about 45 packets of tabletop saccharin. In rats, this agent has been linked to bladder cancer, and so it was actually taken off market in Europe for several years and reintroduced in 2014 when human studies did not back this up. So it is considered safe in humans, and there's no warning label on it regarding bladder cancer. The next is aspartame. So this is another very well-known non-nutritive sweetener, and it goes by the trade names Equal or NutraSweet. It is 200 times as sweet as sucrose. And it's not completely non-nutritive. It has 4 kilocalories per gram, but considering how much you have to have, the caloric intake is really negligible. And it is in many soft drinks. It's in chewing gum, drink mixes like Crystal Light or sugar-free Kool-Aid. It's in yogurts and puddings, instant teas and coffees. This agent, unlike saccharin, can cause some GI side effects, dizziness, mood changes, but only in very high quantities. We're going to talk more about aspartame regarding its effects on metabolic health a little bit later. So these are some examples of products that we might see that have aspartame in them. Again, not all inclusive. And this agent does have a warning label on it because it contains phenylalanine, so it should not be used in those who have phenylketonuria. The ADI for aspartame is 50 milligrams per kilogram, which is about 75 packets of aspartame per day. The next is acesulfame potassium. It's also called Sunnit or Sweet One. And it is also 200 times as sweet as sucrose. Oftentimes, acesulfame is combined with aspartame or sucralose to enhance the sweet flavor and remove some of the bitterness of those other agents, and it's not usually used independently. Also in soft drinks, chewing gums, sugar-free baked goods, and the ADI for this agent is 15 milligrams per kilogram, or about 23 packets. Sucralose should be familiar to many of us. It's also known as Splenda or equal sucralose, and it's 600 times as sweet as sucrose. It's approved for 15 different categories, and specifically, it retains its sweetness at high temperatures. So this is a very popular non-nutritive sweetener to use in baking because it's very stable at high temperatures. It has less aftertaste than the other non-nutritive sweeteners, which often taste a little bit bitter. And it has been the most extensively studied in pregnant and breastfeeding women amongst all the non-nutritive sweeteners. So that gives it a little bit of an edge there. So recently, a lot of the diet soft drinks switched from aspartame because of research indicating aspartame had some long-term cognitive side effects, and they started using sucralose in their products instead. So they all say aspartame free. And then Splenda is another agent that we see used often. The ADI for this is 5 milligrams per kilogram because of how sweet it is, which is about 23 packets a day. Stevia is another one that I thought was pretty new, but it has been around since the 60s and 70s. Also known as stevia in the raw or sweet leaf, sun crystals, or pure via. And it's isolated from a South American plant called Stevia rebaudiana, and it has been described in South American literature as a sweetener as far back as the late 1800s. It's about 200 to 400 times as sweet as sucrose, and the FDA has specifically approved certain compounds from the stevia plant, not the whole plant itself, and not crude extracts. And its ADI is 4 milligrams per kilogram, or only 9 packets a day. Next is neotame. This isn't used very often, but it is in some sweeteners. It's 7 to 13,000 times as sweet as sucrose. So you need very, very little of this to go a long way. So its ADI is 0.3 milligrams per kilogram. And Advantame is the most recent, which came out in 2014. It's in a lot of diet drinks, and it is 20,000 times as sweet as sucrose. The ADI for this is 32 milligrams per kilogram, which is about 4,000 packets. So my thought is they must be really teeny tiny packets, so. All right. Lastly, we have the monk fruit extract. So that comes from the plant Louisville, and it's also known as monk fruit in the raw. It's about 100 to 250 times as sweet as sucrose. And it does not have an ADI determined. So to talk about the effects of this, this is a very hot topic, and there's been a lot of research into it. However, the difficulty with the research is a lot of these studies will not say what their comparator groups are. They don't say, are they comparing which type of non-nutritive sweetener to water, or which type of sweetener to regular sugar sweetened items. They don't say the dose that the people had, how many servings per day. They don't talk about body weight before and after. So it's hard to kind of compare them. We're looking at apples and oranges. So in preparing this presentation, I looked at 3 large meta-analyses that kind of talked more about specifics about dose, type of sweetener used, etc. And so the first is there in pink, and that was a study that was actually published this year by the World Health Organization, entitled Health Effects of the Use of Non-Sugar Sweeteners. And they included 283 unique studies. 50 of them were randomized controlled trials, 97 were prospective cohorts, 47 case controls, and 5 non-randomized controlled trials. 15 of the studies that they included are also ongoing, so there's more data to come there. I also included another one entitled Non-Nutritive Sweeteners in Cardiometabolic Health, which had 7 trials and over 1,000 participants in the randomized controlled trials, and also 30 cohort studies with over 400,000 participants, and a median follow-up of 10 years. Lastly, another one that is entitled Association of Low and No Calorie Sweetened Beverages as Replacement for Sugar Sweetened Beverages with Body Weight and Cardiometabolic Risk. And so they looked at 17 randomized controlled trials in this study. So what is the effect of these non-nutritive sweeteners on glucose homeostasis? In our patients with diabetes, I find myself at least 1 or 2 times a week talking about their intake of sweet tea, juice, sugary coffee drinks, soda, and kind of looking at how we can cut that down to improve their glucose control and lessen their insulin doses, because they're just putting on weight. Even if, our A1C is controlled, they're just putting on more and more weight because we have to give them so much insulin to cover their dietary intake of sugar. So what do these non-nutritive sweeteners actually do to our sugar levels? To understand this, we have to first take it to the molecular level and look at the taste receptor, the sweet taste receptor in particular. So this receptor is a heterodimer, and it's a G protein coupled receptor, and it has 3 main parts. It has a venous flytrap domain at the top, it has a T1R2 subunit and a T1R3 subunit. And so you can see on this figure where some of these non-nutritive sweeteners bind to on the sweet taste receptor, with sucralose binding to the venous flytrap part, aspartame and neotame binding also to one side of that flytrap. So all of these agents work through the sweet taste receptor. It's important to note that taste receptors can be both oral and extraoral, so they're not just in the mouth and in the tongue, or on the tongue. So some extraoral sites of the taste receptor include our digestive tract, such as in the stomach, in the L cells of the intestine, in pancreatic beta cells, in the hypothalamus, and even in adipose tissue. So some studies have proposed the mechanism of these non-nutritive sweeteners on taste receptors all throughout the body and how that influences our glucose homeostasis. So to begin, we can talk about some in vitro studies that explain how these sweeteners work on gut hormones. In cells, both rodent, and human, and other animal cells, these non-nutritive sweeteners activate sweet taste receptors both in the mouth and throughout the body, and they increase GLP secretion and then furthermore increase insulin secretion in response to non-nutritive sweetener. They also noted in vitro studies that insulin secretion itself, independent of taste, is stimulated by these agents because they also have some homology to activate the calcium sensing receptor, which stimulates insulin secretion. So they have effects in other parts of the body as well. But in vivo studies are a little bit different. So there's one theory that these non-nutritive sweeteners kind of interfere with our prediction of caloric intake. So normally when we have a meal with sweet, there's what we call a cephalic response, where sweet to our brain equals calories, and then we can feel satiated and we can eat less. And so if we don't have calories associated with non-nutritive sweeteners, is that still going to be intact, or is it going to make us not feel satiated and eat more, therefore possibly leading to weight gain? So in rats that consumed the diet where they had non-nutritive sweeteners rather than regular sweeteners, they actually did become heavier, they accumulated more body fat, they had decreased ability to compensate for their increased caloric intake, and they also had a reduced thermic response when they ate a novel meal. So this kind of supported the fact that non-nutritive sweeteners mess with our ability to kind of tell ourselves to stop eating. And they also interfere with that cephalic response, which helps to cause insulin secretion to bring our blood glucose levels down after a meal. Additionally, animals that consume a diet that's sweetened with non-nutritive sweeteners were found to respond with relative hyperglycemia when they're given an actual glucose-containing meal, or when they were given a standard glucose tolerance test, which says that these non-nutritive sweeteners, when used regularly in a diet, may cause some form of insulin resistance, even when blood sugar levels are not actually raised. And this study specifically was associated with reduced GLP-1 levels when glucose was given orally, but not when it was given via gastric lavage. So it was specifically through the oral taste receptors that this was mediated. And so the overall conclusion from these animal studies was that there's disruption in our learned responses when we use non-nutritive sweeteners versus nutritive sweeteners. And that's more so when it's given orally. And so we develop some kind of insulin resistance when we're chronically exposed to non-nutritive sweeteners. In humans, there have been some studies trying to look into the response of gut hormones to non-nutritive sweeteners. So one study looked at the acute consumption of non-nutritive sweeteners, namely diet soda or a little bit of sucralose, right before an oral glucose load. And what they found was when you do a sucralose load before glucose, there was actually enhanced GLP-1 secretion in healthy children and young adults that were overweight or obese, but not in subjects with type 2 diabetes because there's impaired glucose regulation. But ingestion of sucralose will increase both their peak plasma glucose and glucose-stimulated insulin secretion in patients that have obesity. There has also been studies that showed that sucralose ingestion tended to increase the plasma GIP concentration, but not in a significant fashion, as the P was 0.08. Another study found that they needed 20% higher than normal concentration of insulin to maintain the same level of glycemic control in obese subjects when they consumed sucralose often compared to if they consumed water before their carbohydrate meals. So sucralose was associated with increased insulin requirements and insulin resistance when compared with water. there have also been theories about how these non-nutritive sweeteners can also affect the gut microbiome and how that is a mechanism for insulin resistance and increased weight gain in this population that uses these agents. Several rodent studies have shown that there is alteration in the gut microbiome associated with glucose intolerance and increased inflammatory markers after prolonged exposure to the sweeteners aspartame, saccharin, acesulfame, potassium, and stevia. But these studies have not yet been replicated in humans, largely because there are multiple factors that affect the gut microbiome. So developing a study that's just going to look at this one aspect would be hard without some bias and confounding. So what have we actually seen in randomized control studies in cohorts? So looking specifically at measures of glycemic control, the World Health Organization meta-analysis created this table, and it shows us at the top cohort studies as well as randomized control trials and these different markers of glycemic control. In bold are the significant values, and they did find a significant increased risk of developing incident type 2 diabetes when using beverages sweetened with non-nutritive sweeteners, and these were in prospective cohorts with a hazard ratio of 1.23. They also found the same increased risk of developing incident type 2 diabetes when using tabletop sweeteners that had these non-nutritive components in them, the hazard ratio of 1.34. Randomized control trials tell a different study, and so this is going to be a theme of today's talk, where the cohorts are saying one thing to us and the randomized control trials are saying something else. And in the randomized control trials, there was really no significant difference, with MD standing for mean difference, in fasting glucose between those that consumed non-nutritive sweeteners and those didn't, in fasting insulin and A1C, in their HOMA-IR, or their fasting glucose. So not a clear association there. What does that really tell us? So there may not be worsening of these values by using non-nutritive sweeteners, but there certainly is an improvement either, not in any significant fashion. And I do think that that is important to keep in mind. Furthermore, in other cohorts, they looked at the risk of developing diabetes as well in prospective cohorts. And what we can see on the top here, out of 28,222 patients that they looked at, there were a number of studies that were significantly against using non-nutritive sweeteners. So for non-nutritive sweeteners is on the left column and against is always going to be on the right. So there were a number that did show that the evidence spoke against using non-nutritive sweeteners if you want to avoid the incidence of type 2 diabetes. And you can see the average of those here, which clearly is against using non-nutritive sweeteners. Using tabletop non-nutritive sweeteners has a similar story, where majority of the trials do show that it is advantageous to not use tabletop sweeteners if you want to specifically talk about the incident risk of type 2 diabetes. In the JAMA Open Network study, they also looked at the same thing. So they looked at multiple markers of glycemic control, and they tried to see if there was any evidence to support the use of non-nutritive sweeteners in comparison with sugar-sweetened beverages. So when we're comparing to sugar-sweetened beverages, again, the left column favors our non-nutritive sweeteners, the right column favors sugary things. And so we could see that majority of them did favor the non-nutritive sweeteners, but the quality of evidence was low in majority of them, or moderate. And so there was a moderate evidence towards improvement in body weight with non-nutritive sweeteners, and in body fat percent, and in BMI, but not in waist circumference as it crossed the line. And the rest of the studies, again, were non-significant regarding A1C, fasting plasma glucose, 2-hour postprandial, fasting plasma insulin, and HOMA-IR. So no clear evidence towards improved glycemic control when using non-nutritive sweeteners versus the typical sugary drinks. And more tables, I apologize. So the other meta-analysis also looked at similar things. And in the randomized control trials in the top of the study, they did not find any significant difference between using non-nutritive sweeteners versus regular sugary drinks as far as BMI, weight, fat mass percentage, waist circumference, HOMA-IR, or A1C. The cohorts tell a different study again, where they did see an increased incidence of type 2 diabetes in patients that use non-nutritive sweeteners versus water or sugary beverages with a relative risk of 1.14 or 1.03. So a little risk, but certainly an increase. And they did find a significant increased risk in the incidence of metabolic syndrome in these patients as well, with a relative risk of 1.31. They also found an increased incidence of overweight obesity in these patients, which was significant, and increased abdominal obesity in particular, with a hazard ratio of 1.59. So, why are randomized controlled trials and cohort studies telling us separate things? So this is a question that I hope to answer by the end of this presentation. Next, let's look at the evidence behind how does non-nutritive sweetener use affect our body weight, because that's really a large part of why we recommend them to a lot of people. So if they're non-caloric alternatives, if you want to reduce the overall caloric intake, this is a good way. If the patient's having 2 liters of soda every day and they switch it to diet, that's a significant amount of calories that we can cut out. So what have we learned from the randomized controlled trials about this? First question we should ask is, does using non-nutritive sweeteners actually decrease our sugar intake? So looking at this WHO study and meta-analysis, they looked at the effect of non-nutritive sweetener use on overall sugar intake per day, and they subgrouped by weight status. And I found this is particularly interesting. In lean individuals, they had a total of 196 patients that were studied, and what they found was really the evidence was on the right, which points away from non-nutritive sweetener use in lean people. And really, you know, when they averaged everything out, across the middle, and it was a little bit more in favor of not using them. So not very clear, but definitely there's no benefit to non-nutritive sweetener use in lean people when it comes to sugar intake per day. When they looked at a mixed population, again, the overall data, was in favor actually of using non-nutritive sweeteners. And in overweight and obese people in particular, there was a lot of evidence in favor of using them and reducing their daily sugar intake. But as we've just seen in the last section, that didn't actually improve their glucose control or measures of insulin resistance, nor did it significantly change their body weight. Next question we should ask ourselves is, do non-nutritive sweeteners actually decrease our overall caloric intake, not just sugar, but everything? And so in the same meta-analysis, they looked at total energy intake in kilojoules per day and whether it favored use of non-nutritive sweeteners on the left or regular sweetened beverages or water on the right. And so the data is kind of split. There are certainly a couple studies that seem to favor use of water or sweetened beverages, and some that are significantly in favor of non-nutritive sweeteners. When they compile all the data together, it seems to be more in favor of non-nutritive sweetener intake on overall energy intake. So possibly using these does help people eat less overall, even though in rats it seems to decrease their ability to control their appetite. In humans, it seems to work out. So, but when we compare the different comparators specifically, so we look at non-nutritive sweeteners more or less, we look at non-nutritive sweeteners versus sugar, we look at non-nutritive sweeteners versus water, things become a little different. When we look at more versus less non-nutritive sweetener, the data is kind of all over the place, but it favors less non-nutritive sweetener use to reduce your overall energy intake. When we look at non-nutritive sweeteners versus water, it's a little more clear that, or versus sugar rather, it's clear that non-nutritive sweetener use is preferable over sugar to reduce your overall kilojoules per day. But in comparison to water, the data is kind of mixed, and it seems to be more in favor of water. So it seems like a common sense thing, but there'll be some graphs later on that kind of contradict this and are very surprising for water versus non-nutritive sweeteners. Overall, they've shown that they've put this down here saying that overall the evidence still is in favor of using non-nutritive sweeteners to reduce your daily caloric intake. What about energy intake based on your actual weight status? So non-nutritive sweeteners based on what your body weight is. In lean people, the evidence seems to be on both sides, but actually is in favor of non-nutritive sweetener use in these 358 people that used non-nutritive sweeteners versus 344 that did not. In a mixed population, again, more of the evidence seems to be in favor of non-nutritive sweetener use. In obese individuals, the data is mixed, but the average data tends to also be in favor of non-nutritive sweetener use. So next, do non-nutritive sweeteners actually decrease our body weight? So one chart that I really liked in this is looking at a study that was actually for weight loss, and these people calorie restricted and used non-nutritive sweeteners instead of regular sweeteners, versus studies that were not for weight loss. And we can see that there becomes a clear difference in those that were actually told to calorie restrict and substitute sugar sweetened beverages with non-nutritive sweetened beverages and agents. There was more evidence in favor of the non-nutritive sweetener use, but again, not significant when you averaged all the data together. When we look at studies that, again, told the individuals to specifically replace every usual serving of sweetened beverage with a non-nutritive sweetener and how that affected their body weight, again, the data was not completely significant, but seemed to be in favor of non-nutritive sweetener use to decrease body weight. And we're talking though, when we look at the kilograms, of a difference in total of minus 0.6 kilograms. So not a very big weight change in these people. And then the effect on BMI, again, is non-significant, even when told to actually replace sugary beverages with non-nutritive sweeteners. So no change in BMI overall, which makes sense because the change in kilograms was very minimal. Mm-hmm. As far as the sweetened beverage, no, they didn't do white versus brown that I know of. Yeah, that is a good question. The question was whether they looked specifically at white sugar versus brown sugar in the nutritive sweetener group, and I don't think they did. All right.
What about, sorry,
Yeah.
hate to interrupt, but what about versus water?
So versus water, the ones that really looked at that were back here. So you could see in the bottom here, versus water, the non-nutritive sweeteners really didn't have any benefit. So it did favor water as far as their overall energy intake. As far as body weight, again, this is the body weight status. And so in this study, it's either non-nutritive sweetener or water plus sugary beverage. And so the data tends to actually be more in favor of non-nutritive sweeteners, which is surprising. But again, multiple of these studies are not completely significant as they have data on both sides.
So not just purely water, but water plus sugary beverage?
Yeah, correct.
Yeah.
Water or water and sugary beverages or sugary beverages alone. And so that, is a really good question that you bring up and is part of the trouble in interpreting these studies because, a lot of the reports of what type of beverages, what type of foods people were intaking were based on patient surveys and their recollection of what they did, unless it was a randomized control trial, in which case they could control one-on-one, but they didn't report them specifically as far as how many servings of water, how many servings of this in these studies. So that's a big flaw in a lot of these studies because the only dose relationship they really describe in some of them is more non-nutritive sweetener versus less non-nutritive sweetener, rather than 2 glasses of water versus 1 glass of non-nutritive sweetener. So that is a major pitfall to a lot of these studies.
Agree. Or 100% water intake. That would be something to look at as well.
Definitely, yeah. Needs to be studied more specifically. So cohorts, again, are going to tell us something very different. And so what we can see in this WHO study, they first looked at the association between non-nutritive sweetener use and body weight in kilograms in prospective studies in adults. And in their data, they didn't really find evidence that favored either side, use of non-nutritive sweeteners or not using them. So there was no really change in body weight in these individuals. As far as waist circumference, same story, but the data tended to favor not using them in regards to waist circumference, which fits with what we saw before as far as increased abdominal adiposity with non-nutritive sweetener use. Lastly, when we looked at specifically abdominal obesity, same thing. So there tends to be more evidence in favor of not using these if we want to reduce abdominal adiposity. But again, all of these data tend to, as far as weight, tend to, kind of fall on both sides. In the next meta-analysis, they looked at similar things, and they kind of split these up interestingly. But in panel A, we can see they're looking at non-nutritive sweetener versus control, which was water. And so they were looking at whether BMI increased or decreased with use of non-nutritive sweetener. And interestingly, they found that BMI reduced with non-nutritive sweeteners compared with water. In the second panel, which was a cohort study as well, they were looking again at BMI in relation to non-nutritive sweetener use, and they found increased BMI with non-nutritive sweetener use, so the opposite of the prior. And then lastly, they looked at actual weight change in kilograms with using non-nutritive sweeteners versus not. And the evidence tended to favor actually weight loss with non-nutritive sweeteners. So this is very different from everything's telling us a different story, right? And so this is really where what Dr. Darshivkar said comes into play. How much did these people actually take in servings of each item? And so can we really call this a fair comparison? So more details need to be shared with us about this. Yeah, so in the first study, it's important to note that these groups had different starting BMIs. In the first group, which seemed to be in favor of BMI going down with non-nutritive sweetener use, these people mostly had normal BMIs to start with an average BMI of 23. In the second group, that was kind of split between both sides. These people were obese with an average BMI of 30 plus or minus 4. And the last group, which also seemed to be in favor of the other direction, but also on both sides, also had overweight and obese individuals. So the actual BMI of the person also makes a difference when determining how these non-nutritive sweeteners are going to affect your weight and BMI. And that seems to be a pattern that we'll see throughout the rest of this talk. So what can we really conclude about weight and non-nutritive sweetener use? My opinion is not much. There's data on both sides, and there's no clear relationship between use of these non-nutritive sweeteners and your gut hormones, between your actual satiety, between overall body weight. There's nothing in favor of them and nothing against them necessarily. So for every positive study, there's a negative study. Randomized controlled trials seem to show either improvement or no change in body weight, BMI, waist circumference, when compared to sugary sweetened beverages. But the data in these studies usually is not significant as far as statistically significant. And prospective cohorts tend to show us no change in body weight or worsening in these parameters, and increased diabetes, increased abdominal adiposity. And the naysayers of these studies have basically put this down to reverse causation or confounding, and said that therefore these studies are not valid. What seems to be a trend, though, is short-term substitution. Taking sugary beverages and replacing them with non-nutritive sweeteners was not actually consistently associated with weight loss. So that's actually an application that I see in the clinic all the time. That's what I tell my patients. At least for a little while, try to cut out your soda and try diet. But long-term, it didn't seem to be associated with weight loss. However, the longer trials that studied for a median of 10 years did show that there was modest and significant increase in weight, BMI, and waist circumference in people that regularly used sugar-sweetened beverages, especially those that were already overweight or obese to begin with. So maybe not as harmless as we think in those patients. All right, so what is the relationship between non-nutritive sweeteners and cardiovascular disease? So looking at hypertension first, in the WHO study, they looked at the relationship between intake of non-nutritive sweeteners and risk of hypertension. And basically, they found that majority of the studies favor not using these agents when it comes to blood pressure control. There's no benefit to blood pressure in using them, but not necessarily, but there is a minor increased risk of hypertension in these people. specifically systolic blood pressure, data is kind of on both sides, and doesn't really show any benefit or harm in using non-nutritive sweeteners on systolic blood pressure. When we look at systolic blood pressure in the next meta-analysis here, they show that there's moderate amount of evidence that actually favors use of non-nutritive sweeteners as opposed to sugar sweetened beverages to improve systolic blood pressure as well as diastolic blood pressure. But again, these do cross over and are non-significant. When it comes to using no-calorie sweetened beverages compared with water, they looked at lipids, and there was a low-quality evidence that seemed to be in favor of non-nutritive sweeteners as opposed to water. But again, this was low quality, and there was data on both sides. When it comes to systolic blood pressure, comparing these non-nutritive sweeteners and water, surprisingly, if you just look at this, it looks like there's evidence supporting use of non-nutritive sweetened beverages over water to improve your systolic blood pressure. But again, this was very low quality evidence, and so we have to take it with a grain of salt. An overall summary of cardiovascular risk factors and their association with non-nutritive sweeteners. In cohort studies, again, this is where we see the significant increased risk, statistically significant. So they showed a slightly increased hazard of cardiovascular mortality with non-nutritive sweetener use, and this was dose dependent. It was not compared with water or sugary sweetened beverages. So a dose-dependent increased cardiovascular mortality and an increased risk of cardiovascular events in coronary heart disease, stroke, and hypertension. And there was really, in randomized control trials, no difference in cholesterol. That's the thing. So in the randomized control trials, they're either comparing use of non-nutritive sweetener to water.
The cohort study.
In the cohort, it's the amount of non-nutritive sweetener use.
No, but what is the versus what? People who are not?
So more versus less. Yeah.
Because my question is it simply because using these already have a higher risk?
Exactly.
And therefore they're going to have this because not that the non-nutrient sweeteners actually increasing the risk. These people already were at a high risk.
Right.
And didn't do anything.
And these things. So Dr. Mokshagundam's question is, what are they comparing to in these studies, in the cohort studies that have increased cardiovascular risk? And so the point, is, are these individuals that already had these risk factors, and the association they're seeing has nothing to do with the non-nutritive sweetener use. So again, this is part of the downfall in the evidence, in that most of the cohorts did compare less non-nutritive sweetener use to more, but they didn't specifically tell these individuals in most of the studies not to drink water, not to drink sugary beverages, these things. So the evidence is confounded, and so that's part of the problem. But in the ones that looked at glycemic control and weight loss, they did compare in the cohorts non-nutritive sweetener versus water and non-nutritive sweetener versus sugary beverages to make those. But the cardiovascular...
Was the aim of the study for everybody gets the same?
In cohorts, no, it was ad lib. Cohorts, it's like live your life, do what you want, and we're going to figure it out. No, it doesn't. No.
But even in the RCTs, were they specifically designed?
Yeah. So in RCTs, they were specifically designed to compare the non-nutritive sweetener, which was the intervention, versus either water or sugar beverages.
So other than the non-nutritive, or was there anything else that was?
In some of the studies, that I showed, they did have one chart on weight loss studies where they specifically also did caloric restriction on these patients. So weight loss. These 4 studies were weight loss studies where they caloric restricted and used non-nutritive sweeteners in place of sugary sweetened beverages. And the evidence was non-significant, but tended to favor non-nutritive sweeteners versus sugary beverages.
Because honestly, in terms of how much calories you're getting,
Mm-hmm.
and sugars
Mm-hmm.
I'm drinking.
Exactly. Yeah. So, what was said was that if you're not drinking many sugar-sweetened beverages anyways, then changing to non-sugar sweetened beverages won't make much difference. And I think that's a very fair point. Um, you know, but if we consider the audience that we usually tell to use these sugar substitutes, these are people that do have high intake of sugar in their diet a lot of times, especially, in our lovely state. So we have a lot of people that just drink soda by the gallon every day. So um, my aim was to hopefully sift through the evidence and see if me telling them to switch to diet is even going to be beneficial to them. And in what way? There's a lot of things to look at. Is it going to improve their sugar control, and therefore I can give them less insulin and maybe help them with weight loss in that way? Or is it just going to help them lose weight in general because they're going to have less calories? So what is going to be the end point here? And so when we look at the cardiovascular data, again, it's very neutral. There are studies that say that there is improved blood pressure control when substituting sugary beverages with non-nutritive sweetener, and there's also data that says no difference, between non-nutritive sweetener and any other type of intervention. And so even the ones that do favor non-nutritive sweeteners are considered low quality. So I don't have any good benefit there. As far as lipids, there is maybe a non-significant improvement in cholesterol, specifically HDL becomes a little bit better when using non-nutritive sweeteners versus sugar-sweetened beverages. So a couple other things, just quickly. I know this is a topic that I could probably talk about for days and days, but you guys are all busy and have things to do, so I will wrap it up. So cognitive function and non-nutritive sweetener use is something that actually got a lot of attention, specifically with aspartame, and is part of, I think, the reason why a lot of these soda companies switched from aspartame to sucralose as their sweetening agent. And so there have been studies that do show increased 10-year risk of developing dementia with use of non-nutritive sweeteners versus water or any other type of beverage. And the hazard ratio was 2.5 times and 2.8 times for Alzheimer's and dementia. And that's even when adjusting for other risk factors for these disease processes, such as type 2 diabetes, family history, cardiovascular disease, and hypertension. So there is a link there, but this is not a strong warning on the label of aspartame or any other sweetener. There is also evidence that, favors, again, not using non-nutritive sweeteners when it comes to incidence of stroke in cohort studies. And then a positive for them is dental health. So as opposed to sugar, these agents do not increase the risk of cavities. So the dental community is a very big fan of them. Like we saw before, xylitol, one of the sugar alcohols, and they have bacteriostatic properties. So they will be good for your teeth as opposed to sugar. So with all those charts and all that data, what are we going to tell our patients? Okay, so the way I look at it is this. In someone that is trying to lose weight or improve their glycemic control, I do think that there is a benefit to getting to a point where they can eliminate any kind of sweetened or artificially sweetened beverage and focus on water as their primary beverage, because that doesn't have all these other complications. So if they need to use artificially sweetened beverages for a period of time when their intake of sugary beverages is high, I think that is something that I would recommend and I would support. But the data seems to show that there's really no benefit on their weight by that. But it's going to be a behavioral change, and it's going to help them switch to water and change the way they taste things. When we tell them to do this, does this make them eat more? That's another concern that there is. When you don't taste sugar, does that make you eat more? The evidence doesn't really show that, Long term, there may be some impact on insulin resistance if they don't already have diabetes. So I would not encourage a lean person to suddenly start drinking a lot of diet soda. But otherwise, I'm not sure that there's a lot we can say in either direction. So I think it needs to be an individual decision. I really think also the American Heart Association said it best, and they said for those that consume sugar-sweetened beverages regularly, a low-calorie or non-nutritive sweetened beverage may serve as a short-term replacement strategy, but overall, people are encouraged to decrease both types of beverages and focus on water. So that is what I'm going to go with for patients and also for myself. So if you see me with a Red Bull around campus, shake your finger at me. This is my last sweetened beverage, I promise. And with that,
The same thing or supposed
a lot of black coffee. This is not black coffee, unfortunately. And with that, I will conclude and take any questions. Happy May the 4th.
Oh, hi. Can you hear me?
Yeah. Hey, Dr.
Yeah,
Levinson.
this is Stanley Levinson, and this isn't a question, but it's sort of a joke, I think. One of my nieces once told me she never drinks calories unless it's in alcohol.
There you go.
And
Alcohol is usually a low calorie beverage, depending on the
I
type.
have gone by that idea.
I think that's a good point, and kudos to your niece. All right. So Dr. Coatwell has asked, do NNS pass the blood-brain barrier and what adverse effects are observed? So yes, they do. And so as we remember, there are taste receptors even outside of the tongue and oral cavity. So there are taste receptors as such, sweet taste receptors in the hypothalamus. And so using non-nutritive sweeteners does also activate those and kind of in vitro change the way that the hunger response is initiated and the hormones that are secreted and our ability to feel satiated or the chemical responses that indicate satiety, such as ghrelin, etc. So ghrelin is suppressed with non-nutritive sweetener use in cell models, but none of those studies have really been duplicated in humans. And what we saw is that when they compared non-nutritive sweetener use to water or to sugary beverages, there was really no change in overall caloric intake in any significant fashion. So it really doesn't play a role in our satiation or our appetite. And why can non-nutritive sweeteners be slowly replaced with no sugar diet? And no. So if I understand your question, be slowly replaced with no sugar diet. Why can they? I think they should. I think non-nutritive sweeteners should be replaced with a no sugar diet. I don't think so. Downsides, mood swings. So we know sugar addiction is a thing. So mood swings are a possible side effect, and that might be why people may choose to slowly step down and have the ultimate goal of not having sugar or artificial sweeteners. Yeah, sugar tastes. Dr. Milk says sugar tastes good. It tastes great. And a lot of these non-nutritive sweeteners do have a bitter taste. I'm not going to tell you which one. Well, I think I already did tell you which one doesn't, but most of them are a little bit bitter. So, yeah. All right. Okay, so two things. How do you plan to apply? Yeah, no more Red Bull for me, Dr. Folsom. I'm going to drink my black coffee, which, I know all the evidence supports increased black coffee. And a podcast. Good. So you guys can all see this link that Dr. Folsom shared with us that talks about this topic and hopefully sheds some more light on the subject. So, in summary, my friends and esteemed colleagues, at the end of all those charts, I have no wisdom, and the evidence doesn't point in one way or the other. So it's a patient-specific discussion, but we should try to get rid of them. Yeah. All right. Thank you guys so much.
Oh, okay. That's fine. I was going to say quickly.
Yeah.
Great talk. And, I don't know if you've seen this, but most folks who do drink regular Cokes and other sugar beverages will tell you they hate diet drinks. So that's one thing. The other thing is, I don't think going from a big evil to a lesser evil is necessarily the right path. So telling them to move from Coke to Diet Coke, it's probably, both ways. I think it's from poison to lesser of a poison for me. That's what I would always say. So it's probably better to divert them to something which we know is not going to be potentially bad. And one of them is, just tea. Tea can be a great substitute, not the ones that are prepared. And I tell them there's so many just tea bags. You can just put it in water and make your own tea, not have to add anything. You can have a lot of fruity teas like pomegranate tea, which is just desiccated, or orange ginger teas. They're just desiccated fruit with the tea and more flavorful. So trying to divert them from even this idea that they need to be
of the artificial.
Exactly. Because eventually, if they need to come off of it, why not just take the step right away? Why make them go through another difficult thing to get off? Because sugar, as everybody knows, is as potentially addictive as cocaine or worse.
Hmm.
And similar, is the story with our other fatty and salty kind of foods. They're all just as addictive. So the sugar taste, your taste buds get desensitized to if you keep drinking a lot of sugar. So getting them off of that um, sugar brain kind of a positive cycle is probably a better thing to do
Yeah,
than trying
agreed.
to just reinforce it.
Agreed. And I think that's one of the hardest things. We know that, really telling them not to do the greater evil and lesser evil, like you said, is the way to go. But there are some people that are so adamant about whether it's like you said, they don't like the taste of diet things, and that is their, stopping block, or they want that carbonation, which for me personally was a big thing when I stopped drinking like regular soda, because I like carbonated things. I like the little bubbliness of it. So, I'm trying to find creative ways of getting them off. I think if anything, doing this research showed me that in cohorts, when people are left to live ad lib and do what they want and use as much sugar sweetened beverage as they want or non-nutritive sweetener, there was still insulin resistance and weight gain. And so it's not going to mitigate those factors. So that could be something, a reason for me to say, okay, maybe give it a little try, but this is not a long-term solution, and we have to, eventually um, do what's more healthy. And I love your suggestion of using natural sugars and natural sweetness rather, like in flavored teas or fruit teas. I think that's fantastic. All right.
Thank
Well,
you.
thank you, everyone.
You're welcome.
Enjoy the rest of your day.